Hi, Dr. Kimberly Wilson here at Inspire Physical Therapy. So glad to have you join me again for these videos. Today I thought I'd do a little something different. One of the things that all of us ladies have in common is that we have our menstrual cycles. And movement is really important during that time. We can use these strategies to decrease pain and inflammation and just sort of support our cycle as we start to either feel it coming on, so sort of that premenstrual time, or right at the beginning of our menses. A lot of times there's a lot of discomfort, cramping, muscle tightness, headaches, just pain in general. So movement can be really beneficial during that time. So I thought I would do just a series of movements. Some of them are or most of them actually are very yoga based, but they can stimulate good blood flow, good lymph drainage, just general getting our bodies moving and feeling a lot better. And to that, I would say, everybody's not equally flexible. It depends on how active that you already are and how long you've already been working on some of those things. So it's always important to modify. So I like to keep things like yoga blankets nearby, maybe yoga blocks. Modify as much as you need to continue moving, but not cause any pain or discomfort to the point that you feel like you might injure yourself. So we want to avoid that as much as possible. But absolutely, every movement is modifiable. You can adjust it to meet your body where it's at. So join me here on the mat if you'd like to, and let's just kind of get started.
Do a yoga pose that I like to call a bent knee snow angel. And so the purpose of this, you see I'm moving my arms. What you want to do is you want to take your arms up as far as you can and to the point where you feel some restriction. And then you're going to let your bent knees fall to one side. And you're going to take your head and turn it in the opposite direction. So here we get some stretch on the myofascial pieces of your body. And then you're going to breathe into the tightness, or where you feel the tightness. As I move my right hand over my left ribs, really what I'm doing is just sort of monitoring those ribs and giving myself some feedback of where I want to focus my breath. And so I like to do this one for 5 breaths on each side, really focusing on good rib expansion. And the sweet sauce really is getting a full exhale, some of that ha breath where we are completely emptying the lungs with the exhale and allowing the ribs to collapse. And you can see that I switched sides, took my knees over to the left side, my head toward the right. And again, I'm taking my left arm over my right ribs and just sort of giving myself some feedback of where I want to focus my breath. It's a great little stretch, power of the diaphragm. So from here, what I'm doing is I'm just bringing each leg up. I'm starting with the left leg, taking my hands around the back of my thigh and just passively kind of rocking those hips in the hip socket, just to loosen things up a little bit, get some blood flowing, get some synovial fluid in the joints, because I'm getting ready to stretch those hips a bit and move them through some challenging positions potentially. So just want to get some things moving there as I'm rocking with my hands and just breathing. I'm moving into a modified or a single leg happy baby pose. So take my left hand, grab the pinky side of my left foot, and bring it into that happy baby pose. And I'm going to breathe. And when I'm doing these poses, I like to do breaths versus thinking about holding it a certain amount of time. I think 5 breaths is a great place to start. 5 good inhales and exhales. Expanding the ribs, allowing your body to relax, and then fully releasing on the exhale. Awesome. So now I'm going to bring both feet up. So full happy baby pose. Bring your feet together. Support at your ankles or around your feet, whatever you feel comfortable with. Stay nice and relaxed. And again, 5 deep breaths. Focus is on the ribs. On those inhales, let that air, let that breath go all the way to the pelvic floor. Happy baby is a great pose to be in for relaxing your glutes and your pelvic floor and getting full breath into all those areas. As I come up to a seated position, we're going to move into a low lunge. Going to get the front of the hips to open up. Leg between each hands there, that front leg, just position it between each of your hands. Your back leg goes back just enough to where you can feel a good stretch in the front of the hip. And again, you're breathing into those areas that you feel tightness. Opening up all those spaces. Let those muscles relax. And then we're going to switch sides. Bringing that front foot again in between your hands as you sink into that stretch, opening up that back hip. Breathe into those tight spaces. Lots of good blood flow here. Awesome. Now we're going to move into a little puppy stretch. Going to tuck those toes under there. Shift into a good little stretch. Placing your head on the ground and reaching your arms out in front of you. I'm going to reach up and grab a yoga block, show you how we can modify this stretch. Instead of bringing my head all the way to the ground, I'm going to just relax it on the yoga block. A little less intense for me, but we still get some really good benefits here. And again, you're going to focus on the breath. And we're going to breathe into all those spots, all those tight spaces. Really bring your mind to become aware of your pelvic floor, of course. That's super important during your menses. From there, we're going to move into or shift into a full-on child's pose. So we bring our feet together and our knees apart. Relax your hips onto your heels. Bring your forehead to the ground, arms outstretched in front of you. And then again, breathe. Breath is so powerful. Helps us to relax, tells our nervous system that we need to relax. Slows the heart rate. We're going to shift over to the left. We're going to just kind of walk our hands over. Open up that right side of your torso. Again, shift those hips back as close to your heels as you can get them. Breathe into those tight spaces. Now walk our hands over to the right and do the same thing there. I'm going to open up that left torso. Breathe into those tight spaces, opening up the body and bringing your mind to become fully aware of all the things that you're feeling. All right, we're going to roll ourselves up. Bring ourselves up into a downward facing dog position. Going to alternate our heels toward the ground, bending and straightening both legs there. Again, relax and breathe. Right now we're going to step forward. Inhale slowly as you come up to standing. Reach your arms up as you exhale. Bring your hands down and we're going to shift over to the side. We're going to bring our feet out wide, feet parallel to one another as we come down into a forward fold. We could do a couple things here. We can bring our hands down and let everything sort of relax in that forward fold. And we can also bring our hands behind our back and get a little stretch going on there too. Keep your head hanging over as you remain in that forward fold and breathe into that position. All right, we're going to move into what is sometimes called a bound angel pose on the floor. Looks a bit like a butterfly position. You're going to inhale and bring yourself forward as far as you can go. Bending at the waist. If you can go all the way over, fold forward. Feel free to do so. I'm a little tight there, so I'm not going too far forward, but that's something I'm working on. Again, modify, and meet your body where it is at. If you'd like to get just a little bit of a deeper stretch, you can put your elbows out toward your knees. All right, now we're going to take those legs straight out, and we're going to do another forward fold. You're going to sit up real tall and inhale, and then exhale as you fold forward. You're going to reach those arms out. Hold it there and breathe. All right, we're going to bring your legs in. Come back to lying on your back. You're going to take that position where we're going to stretch the piriformis muscle, or pigeon pose. Cross your left foot over your right knee. Take your hands and grab your right thigh and bring it back till you feel a good stretch. I'm going to show you how to modify this position because sometimes this is a little bit too intense. Just depends on how tight those back muscles, those pelvic floor muscles are. So I'm going to bring my left foot to the outside of my knee, my right knee there. Bring my left knee in toward the opposite shoulder. So I'm still going to feel a stretch in the same area. That's just a little less intense. Now we're taking right foot over left knee. We're going to repeat the process. Both hands grab the left thigh, bring up towards your chest till you feel a good stretch. And we're going to breathe in that position. Try to open up those tight spaces. And once again, I'm going to show you how to modify that side as well. Keep that foot on your left knee, and we're going to bring that left knee up toward the opposite shoulder. Feel a good stretch there in that piriformis and glute area. Breathe into the tightness. All right, so we're going to do a butterfly stretch or a butterfly pose. But I'd like to show you how I like to modify this one because it's quite often it's a little bit challenging for people just because they're so tight on the inside of your leg. So we don't ever want to force that pose. So what you can do is take some yoga blankets and place one on each side of your knees on the outside, so that when you assume that butterfly position and you relax your inner thighs, you don't quite have as far to go, and so those muscles can fully relax and they don't feel tense. It's a great little modification. Still get the benefits of opening the pelvic floor and the inner thighs, but it's not quite as intense. So I like to modify that one when and if it is necessary. Easy little modification makes it doable and much more therapeutic. All of these poses are good for relaxing the pelvic floor, for the menses, also really good for treating pelvic pain in general or an overactive pelvic floor. There's really not very many people that these poses would not be good for. give them a try. Very therapeutic, and get things relaxed and moving so much better. Moving into just a laying flat position, you're going to do palms up. You're going to bring your thoughts and your mind inward as you breathe. Moving into the final phases of these moves, and you really want to cleanse yourself with your breath there. Roll to your side, press up with your arms, come up to a seated position, and we are done. Awesome.